This podcast and content posted by Dr. Judith Joseph is presented solely for general informational, educational, and entertainment purposes. The use of information on this podcast or materials linked from this podcast or website is at the user's own risk. It is not intended as a substitute for the advice of a physician, professional coach, psychotherapist, or other qualified professional diagnoses or treatment. Users should not disregard or delay in obtaining medical advice for any medical or mental health condition they may have and should seek the assistance of their healthcare professionals for any such conditions. Hello, I'm so grateful that you chose to listen to this podcast. I'm Dr. Judith, a board-certified psychiatrist and researcher. And on this podcast, you will hear from world-renowned experts. At the end of every single podcast of The Vault, every expert talks about a time in their lives when they were struggling and no one knew it. And they talk about what they used to get through that struggle. So make sure you listen through till the end and you subscribe and share with a friend. Dr. Drew Ramsey and I met at Columbia, where we both trained in psychiatry and where we both taught residents and doctors who were in training how to use social media and media to educate the public about mental health issues. Drew and I both felt like outsiders when we joined Columbia. We're both from humble beginnings, and we felt out of place in a really fancy Ivy League institution. But that didn't stop us from being our authentic selves. Drew comes from Indiana and lives on a farm and teaches people how to use foods to beat depression and anxiety. He also teaches people how to decrease inflammation in their bodies and brains so that they feel happier and healthier. We talked about Dr. Drew Ramsey's new book and his e-courses to heal the modern brain. People don't think about how their food can actually impact, like a meal can impact your mental health. And I learned something new today.
Anthocyanins, and those are just pigment molecules in food. Yeah, let me do my list for you. What are the real barriers? I think, one is taking the opportunity. That can be chewing more. That was the big lesson I had with the patient today. He's doing such a good job eating, but he said, and then I wolf it all down. I know I need to do better. And so I think that when we are really trying to be mindful about feeding our mental health, eating nutrient-dense foods, eating the foods I recommend in both healing the modern brain and eat to beat depression and anxiety. I think number 2 is that we are making our food choices based on fear and misinformation. We spend a lot of time thinking about things like dietary cholesterol or thinking about salt. And, these are important, but only if you eat processed foods. If you are eating whole foods, you eat apples and pears and, even like grass-fed beef and arugula and kale, lentils. I always say lentils a lot. I have my little rhyme, seafood, greens, nuts, and beans. You don't need to be in a fear-based food environment. You're eating food that's good for you. You can be in a more pleasure-based environment.
On this episode of The Vault, Dr. Drew Ramsey talks about how to eat foods to have better focus, to feel less stressed, and to be more joyful in life. You won't want to miss this episode of The Vault. Dr. Drew Ramsey, thank you so much for coming on The Vault today. It's so great to see you again.
Dr. Judith Joseph, what a treat. It is such a treat to get to talk psychiatrist to psychiatrist and have our friends in our communities here with us. So I can't wait to speak with you. Hey, everybody.
I have to say, I recommend your book to most of my patients, and it is so important. What you do is preventative, and you are a leader in the field. And it surprises me about how so many people don't even know that what you eat and behaviors around food can impact your brain, the way that you feel, the way that you behave with others. And there's just so much power in that. So tell us about what you're working on now and your new book.
Well, Judith, thank you so much. There's no greater compliment from a clinician, a great psychiatrist like yourself, to know that my work is helping influence you and your patients and getting out there. And I completely agree with you. It is a little surprising. And really, this new book, Healing the Modern Brain, picks up on that. I trained at Columbia, great program, one of the top in the country. We didn't really talk at all about food or nutrition, other than eating disorders. You've trained top places in the country, right? It's just not part of our mental health system, or at least it wasn't 15 years ago when we really started getting interested in nutritional psychiatry. I think that same idea applies. We don't really think about our nutrition related to our mental health. We don't think sometimes so much our sleep hygiene and our movement. We know they help our mood, right? But really is actually quite fundamental to, excellent, optimal mental health and building mental fitness. And so, what I've been up to really is a big transition in my life in a lot of ways, and then learning and kind of seeing all these mental fitness lessons from my patients, and in my own life, and wanting to pull those together with this new evidence that we've seen of just, you and I are talking about very different things than prior generations of psychiatrists and mental health professionals have thought about. So it's a very exciting time, and I think that gets missed, right? There's so much confusion and what's the root cause and do meds work and should you eat this or that? And it kind of gets missed, whoa, it is a new era when it comes to taking care of our brains and our mental health, and there's so much good stuff we can do.
And there are a lot of people now talking about food and processed foods and dyes and toxins, but there's also a lot of misinformation. And some of the people who are talking about, this, they don't have your training. They don't know human behavior. They don't understand depression or anxiety or ADHD and dementia. And so having someone who is skilled and trained and has studied this for over a decade, write these books and guide us is really a gift. And so if you could say, what are the top 3 things that people do that they shouldn't be doing when they're eating meals? What are those top 3 things that most people do? And if they only knew that they shouldn't be doing these things, they would live a happier and healthier life.
Okay, well, I think the first lesson and mistake that I see people make as an expert in nutritional psychiatry and an eater myself is I see that we neglect the power of a mealtime to impact our mental health and really to milk it for all it's worth. When you sit down to a meal of wild salmon and arugula and, I'm on a big black rice kick right now, just so into that and all the anthocyanins in there. But
what did you say? Anthocyanins?
Anthocyanins are the molecules in nature that make food purple and black. So when you look at things like dark sweet potatoes or blackberries or blueberries, and the cool thing about anthocyanins, since you're a research nerd like me, is we've always thought, we've known these things are, related to mental health. Well, the way they work and influence brain health is actually by the microbiome. They influence all the organisms that live in our gut. And that's how they have their anti-inflammatory effect. And it's, I guess, a good example of, again, this new level of science that we have that really helps us think about food and helps us think about mental health.
So number 1 is people don't think about how their food can actually impact, a meal can impact your mental health. And I learned something new today.
Anthocyanins, and those are just pigment molecules in food. Yeah. Let me do my list for you. What are the real barriers? I think, one is taking the opportunity. That can be chewing more. That was the big lesson I had with the patient today. He's doing such a good job eating, but he said, and then I wolf it all down. I know I need to do better. And so I think that when we are really trying to be mindful about feeding our mental health, eating nutrient-dense foods, eating the foods I recommend in both healing the modern brain and eat to beat depression and anxiety. I think number 2 is that we are making our food choices based on fear and misinformation. We spend a lot of time thinking about things like dietary cholesterol or thinking about salt. And, these are important, but only if you eat processed foods. If you are eating whole foods, you eat apples and pears and, even grass-fed beef and arugula and kale, lentils. I always say lentils a lot. I have my little rhyme, seafood, greens, nuts, and beans. You don't need to be in a fear-based food environment. You're eating food that's good for you. You can be in a more pleasure-based environment. And so I think the second notion of really not having your food choices be based on fear, but based on brain growth opportunity. I think that's really a huge mistake I see people make. And the third big mistake that I see people make is they don't have dried lentils in their house. I just think that this is an example of an easy, quick, go-to food. Saute up an onion, some olive oil, you make some lentils, little celery and carrot in there or not. They cook up really quickly. 18 grams of protein in a cup. You get, I think, 67% of your daily you get 67 of your percent daily need of fiber.
Really?
And you get about 90% of your daily need of folate, vitamin B9, which you and I, that's like one of the most important nutrients when it comes to depression. Like everybody agrees.
You said folate. 60% of fiber? 60?
67.
Wow. I eat lentil soup every day. There's a great restaurant downstairs, and they make the best lentil soup. I eat it every day. I'm one of those boring people that likes to eat the same thing for lunch every day. For years, it was salmon.
When it's lentils and lentil soup, I'm not sure that's so boring. I mean, I hear what you mean. It's maybe not. It's not a lot of variety, and we want to maybe mix some things up. But the idea that having lentils be one of those central pieces of your diet. I'm joking a little bit. Lentils are one of those foods, but I try to focus on these nutrient-dense foods, foods where you get more nutrients per calorie, and then you're getting these nutrients that we know. And I go over a lot of the science in healing the modern brain. We just know these nutrients do a better job for mental health. You eat more B vitamins, you have more B12 in your diet, B9 in your diet, B6 in your diet. You have a bigger brain as you age. It's just very clear in the data. You have less risk of depression, very clear in the research. And so the reason I call the 9 tenets in this book is there's so much like controversy, even in nutrition. It's like, and there shouldn't be. And I think that our patients and everyone listening, and we just deserve a little better. We need to honor there's really great science, and there are tenets, there are truths that we can believe in, that we know and we feel are good for our mental health. And that's what this new book's really about, is taking this idea, as you said, from nutrition and getting into a much more proactive stance about our mental health, and again, this idea, let's build mental fitness.
I like the idea of joy, because I research anhedonia and the lack of joy, and I do a lot of awareness about people who, they think they are humans doing, but they have to remember that they're human beings, right? So when they eat, they rush through the meal. They don't savor it. It's just to satisfy that feeling of hunger, right? But not really to savor and to enjoy a moment. And a couple of years ago, I had a chef come to my lab for Employee Wellness Day, and he made a meal for us, and he brought real plates and real forks and everything, glassware, everything. And he set it up, and he used the lab as the kitchen. And he said, it's really important to use real cutlery, because when you eat with real cutlery, you eat slower. Because you're like, I'm having a meal. I'm not just like eating lunch. It's not just my break. I'm actually having a meal and enjoying it, and I'm chewing it. And when you eat with cutlery around a table and it's social, you eat slower. You tend to chew more, like you enjoy it. It's an experience. And so after that, we started really bringing in real cutlery and real plates and cups. And then he also said another thing. He said, a lot of the containers that you're eating out of are plastic and paper, and some of those are seeping toxins into your food.
Boy. Yeah, especially right. And we had to just, we're speaking at a time again, great time to have a brain. We just learned about the concentration of microplastics in the brain, one of the areas where it tends to accumulate. Everybody who knows neuroscience knows these things are true, because all of these plasticizers are fat-soluble nutrients. My very first book in 2011, The Happiness Diet, we actually had to cut this chapter. And it was a chapter on toxins, like the lost chapter of The Happiness Diet.
Wow.
And so I was kind of in this research 2008, 2009, where you see the phthalates, the plasticizers, the obesogens, all these molecules that are kind of out there, again, lurking in the modern world. And so it's really a time for us to take charge. It's a time to kind of sound a call that we can't be taking care of our mental health in the same way that we have in the past. We can't have this passive notion that we're just going to sit around until someday, with a lot of resistance and stigma, you'll come and see one of us, come see a psychiatrist or mental health professional. We need to do more for our mental health these days, and plastics are one of those examples, right? You get all your stuff heated up in the microwave in plastic. Drink out a lot of plastic bottles that have been hot, have, even things like your herbal tea. This one really upset me, because I love my herbal tea. It's like, this is like my super little wellness. I love it when I have a cup of tea, right? just feels like good medicine. Like everybody agrees, like chamomile tea for insomnia. It's like, well, we all agree you should try it, and there's a little data even maybe, or lavender, I guess there's more data. But the point being, if you use those fancy nylon tea bags, you're getting, I think I saw 2 billion particles of microplastics in your tea. And so I think it's just, again, the book asks people to take a bit of a step back, because tea is wonderful, but there are some simple moves that you should make in the modern world, like using loose leaf tea, and your own little tea strainer. There are moves that you should make around, as we've noted here, your food. And then I think there are also ways that our mental health is being eroded. We can talk, and I think we should be talking about like the isolation epidemic, but that really leads us in our everyday lives to think about the tenet of connection, right? And how we use that and promote that and deepen those connections in our life to, again, support our mental health by building more mental fitness.
And the isolation is important because when you're eating by yourself and you're not socializing, you tend to overeat to soothe. And I remember with the plastics, growing up in Trinidad and then coming here, we used to cut the orange peel and boil the orange. And we never used all of these disposable things. And, coming to a more industrial country where everything is in plastic, everything's ready to go, everything's convenient. You forget that in simpler times, you didn't have all of these added things. The things that are supposed to make your life easier in the short run make your life harder in the long term, So when you think about what you can do, the small steps, they may seem tedious, but boiling your loose leaf tea, like not microwaving things and eating more fresh things, more fresh foods, less processed foods. It's convenient now, but in the long term, it's very inconvenient, and you may be faced with negative health outcomes, both mentally and physically. You talk a lot about specific foods to target specific symptoms. Tell us about someone who, let's say they have anxiety and they've tried therapy, they've tried medications. I know that you use a lot of cases where you have clients that have tried, the traditional models. And then when you modify their diet over time and they stick to their diet, you see remarkable outcomes. So tell us about some of the interventions for someone who has anxiety.
Yeah, when we think about something like anxiety, first, we want to rule out medical causes. As you note, there are a variety of medications that help a number of people. Lots of patients have great responses to medications. And psychotherapy, CBT, psychodynamic are the two that I kind of tend towards, really helpful. That said, lots of people don't get better with those. Well, we have 40 million Americans struggling with anxiety. It's our most common set of disorders, ranging from specific phobias, panic disorder, generalized anxiety disorder. And so we want to think about a set of lifestyle interventions. So with food, we think about, where are there things that can be stimulating or cause anxiety? Theobromines in chocolate, green tea. I have a number of patients who take supplements, get supplements from a variety of practitioners, and some of those have a lot of stimulants in them. A lot of supplements also have stimulant analogs in them. So trying to identify any kind of causes of extra stimulation. Once I was, a young woman was sent to see me, really smart young high school senior. And the reason she came is that her parents were worried that she was getting addicted to caffeine. She was drinking a lot of coffee. And, coffee generally has pretty good health benefits. She was an adult. When you got to the root cause of why she was drinking so much coffee, it's because she was so tired. She was so tired because she was taking 10 times the recommended dose of melatonin.
Wow.
And so, sometimes when there are things like anxiety or things like sedation, and we get down to the root cause, it's because something's being done that's kind of throwing off a lot of our naturally healthy systems. One of the tenets, for example, when I see anxiety and I think about along with nutrition and there are a couple other things about nutrition and anxiety, but when I see a lot of anxiety, I often think about the tenet of unburdening that's in the book. Because I wanted to both have there be, clear lifestyle ideas, changes, the classics of lifestyle medicine, really what we as physicians know really works and what everybody listening know really works. And helping with a little bit more of the science of that, right? Actually, your sleep really matters for brain growth. But then there were a few, as a psychiatrist and a psychotherapist, it just felt very important to me. So when I see people with a lot of anxiety, especially like physical anxiety, hypervigilance, I do a lot of work with patients who have extensive trauma. It's some of the most meaningful work that I do. You get to hear parts of people's lives that very few people get to know about. And so sometimes it feels like, along with the tenet of nutrition, things like unburdening is really a way that, in trauma, is a way that I think about some types of anxiety. Mm-hmm. I also see some types of anxiety, again, as a mark of the modern world. You are going to be more anxious if you're living a life of ultra-processed foods, you're not going outside in nature, your relationships are through screens, you don't have a sense of engagement, you're not working on building a community and sense of belonging. It just, kind of universally will cause human anxiety. Why? Because you're headed down a path that you just intuitively know is going to lead you more isolated, more sad, less regulated, less deeply connected. And so, to me, when I see something where it's horrible. We call these patients treatment resistant, and I'm thinking like, man, they've been engaging in a lot of treatment and really trying very hard to call them resistant. I think it's not fair to blame the patient.
I always change it to the treatment failed you. You're not treatment resistant. The treatment failed you. And then people are like, oh yeah, that's true. Because they are trying everything. They've tried
treatment resistant. We should really get rid of that term.
We should.
Actually,
there are a lot of words we need to get rid of.
Well, and I would also say, if we're honest, in practice, is really very honest. It's like, hey, we haven't helped you yet. Mm-hmm. And that's on.
And let's not forget the burden of capitalism and low pay and unequal pay and excessive exposure to bad news all the time. It's it's so hard to be happy these days.
Yeah, well, I think that's in some ways where the book kind of comes from. We're trying to, do a good job, work hard, lead a healthy life. There's a lot of noise now. And it's not like you can just turn it out. It's kind of like with the, we all know the phones and the screens are really hard for us, but we also know we do a lot more with them. We kind of love to relax with them. We scroll way too. I mean, it's a modern conundrum. And
now, I told you that I do recommend your book to my clients, right? But the one thing I've found is that, as therapists, we try to focus on things that the person can control. Mm. But with food, and I'm sure you've seen this, you have to stick to it, right? Even if you start small, you're committing to changing what you put into your body. And for many people, there's a lot of, I wouldn't say resistance, but they try and then they stop. They try and then they stop. Mm. What have you found to be the most helpful interventions?
Yeah, you're going right to the first tenet. Yeah, you're right.
Oh, good.
Well, this is exactly where the book starts.
Okay.
Where I say we have to work self-awareness. As I was looking at the book, and the more it sort of actually began to really make sense when I started with self-awareness. Because when you come and you sit on this couch, you are taking a step into a different way of being. Mm-hmm. You are stepping into a mindset where you're going to have a level of awareness about yourself, your emotional reactions, your thought patterns, how you care for yourself, your trauma, and you're going to do something about it. I mean, that's what a good treatment is. And I'm in your corner really doing everything to make sure that happens.
Mm-hmm. So the book takes you through those steps to become aware as to what you need to heal. Is that what you're saying in the first part?
That is the first step. And yes,
Mm-hmm.
I hope that the book helps people start on that journey. I wish everyone who read it would feel a sense they finish that and say, wow, I've got the self-awareness now. Mm-hmm. My experience with self-awareness and Dr. Judith, I think yours is it's just taken a lot of different ways of understanding myself at different parts of my life. I'm 51 now, and I've been in.
Well, I want to eat what you're eting because I want to look like that when I'm 51.
Thank you. I really appreciate that. Here I am in andropause. I really appreciate that. You can get this way with the Tenets. Everyone, check out the book.
I'll be signing up for that program.
All right, now I'm blushing. I've lost track of where we are here. I don't even know what I'm talking about.
You were telling us about self-awareness and how you can sorry to throw you off.
That's okay. I haven't blushed in a while here. All right. So self-awareness. I hope that everybody, when they get through that book, chapter in the book, has a sense of some of what we can do. Why? Because self-awareness actually increases focus. It increases, I think it's like, I've seen a study, a 27% increase in the activity in our prefrontal cortex, meaning that the part of your brain that does executive function gets better when you write things down, name things in your life, when you journal, for example, or when you talk through an experience. So, I think about like some of the secrets of my success over my life is probably being in a regular psychotherapy or psychoanalysis. Right? Not at times because I was like so symptomatic and struggling, certainly sometimes, but mostly in part of processing and dealing with and kind of sorting through the best strategies in front of me, but also understanding what's going on inside myself. And so you see these brain changes again. As I said, it's the best time to be alive thinking about our mental health because we know so much about the human brain and what influences brain activity. So self-awareness is a huge part of the book because it's asking us like, hey, if you're going to intervene, I tell the story of Charlotte in the book. And Charlotte is a woman who I'd worked with. I've changed everybody's name in the book. Everybody stays anonymous. Don't worry. But Charlotte, like a lot of us during the pandemic, started just drinking a little too much and then a lot too much. And it's one of those things that if we're going to take care of our mental health and not, again, be in this model that someone else is going to pull us aside and finally tell us that thing we know that we should go see someone because we're really struggling. But if we're going to be in a model where we really take control, like Charlotte did, it starts with self-awareness. And she came to me and kind of gained a lot of self-awareness about her drinking habit. It was one of those things as a clinician, it's kind of pleasurable. It's just one of those people is you ask her to count drinks and have an open, honest, non-judgmental relationship, i.e., you want to keep drinking. Like, I'm here to help you do what you want to do. And so that neutrality, I think, really helped her. But she really took great hold of her drinking. And of course, as everyone knows, if you're drinking way too much and you stop or really reduce, your health vastly improves. And so self-awareness just allows us, that you can't manage what you don't measure. I think about self-awareness like that. Like if you're not working on, not really being a good listener, being a little too selfish and narcissistic, or having never really worked out your stuff with your siblings or whatever it is, it's just like, I don't know. This book is here to be like, hey, I think you should take care of that. I think your mental fitness is going to be better and things will be more interesting and lively for you.
So the first tenet is self-awareness. What are the other tenets in your book?
So the 9 tenets of mental health start with self-awareness. And then as we move through, we think about the classics of lifestyle medicine. I talk about nutrition and really try to concentrate down and distill down the pearls of nutritional psychiatry. I try to update people on ketogenic diets a little bit and some of the new science there. But I also try to just kind of give people good, solid, practical advice on places to find the proteins, the fats, the B vitamins, the magnesium, the phytonutrients. There's a lot about fermented foods in there, so nutrition. We talk about sleep and the new science of sleep. We didn't know until 2013 there was a glymphatic system. It's a whole system in the brain that got discovered. The glymphatic system is this very thin layer, and like the lymph system, drains out the waste from our brain, 7 grams a night.
Wow.
So what's the best way to sleep to get rid of that? All that gooey brain waste. Because again, the brain is your most metabolically active organ. Like anything that's burning a lot of calories is going to make a lot of waste. And so we get into some of that, again, new science of how you want to think about sleep, how you want to set up your bedroom, how you want to kind of, again, just up level this like, hey, I try to get 8 hours. That's not mental fitness, right? Mental fitness is for some people having great metrics, for other people really getting into the bedroom and shifting things. So we talk about movement in the book. I'm really actually clear not to talk about exercise. Love all the exercisers, love all my influencers and everybody who's like swole. I think this protein and muscle is important. I agree. But I also think there's a lot for all of us to reconsider especially if you're having a hard time getting moving, to reconsider exercise as movement. And I tell a wonderful story in the book. A lot of this is just like wonderful things patients taught me, of a woman who, like every doctor, I was like, you should exercise. You have treatment-resistant depression. You should exercise. And it was actually really kind of getting in the way of our relationship. And I always felt compelled to say something. And then she came in one day just like really lit up. And I had no idea about her. She was a tango dancer. She started tango dancing again, taking some classes, and just was moving her body like better than any exercise I was doing, and having a lot more fun, and was thinking about all this like social benefit, movement benefit. It was just great. And so that's why I call it the chapter movement. There's so many different ways in my own life and in my patients' life I see them engage with their bodies, whether it's taking a walk in nature, whether it's stretching or yoga, that isn't just about like exertion and endurance. And I just wanted to emphasize how those were so important, how our muscles and moving our muscles does things like increase myokines. Myokines are these molecules produced by our muscles that actually travel to the brain, and they cause an increase in BDNF, this brain-derived neurotrophic factor. So this whole idea that, moving your muscles, moving your body directly impacts brain health is really very exciting. The other tenets, I talk about connection, and we've touched on that a little bit, and how important connection is. And I ask people to map that out. Folks have asked sort of, how do I assess my mental fitness? And there are a couple ways. One, we have a mental fitness assessment quiz on my website, drewramseymd.com, so people can always take that. But also in the book, kind of go through a variety of ways of thinking about how to assess things like connection. When I meet patients, a lot of times in my mind, or even on my paper, I'm kind of mapping out the web of connections that they have. Who are the people, who are the real close ones? Who are the people who are important, but maybe they're not as deeply connected to or as close with? Who are kind of people on the more periphery of their community? What institutions are you involved with? Because, we know what all this great soundbite going around, like isolation is the new smoking, because of this data that's come out showing that social isolation has as much impact as smoking like a pack of cigarettes a day or 18 cigarettes a day or something. I mean, it's like very cool data. And then the book gets into a few more tenets, since we're going through grounding, which is about nature. If you follow me on Instagram, I'm like out and about as much as I can be and love nature, whether it's plants in my house or gardening or being out in the mountains here in Jackson and Wyoming. I think about engagement. Again, whether it's with your food you gave such a great example of this, Judith. You can have a staff meal, or you can have a staff meal with cutlery. And yeah, it's like a little bit of extra work. You got to wash up afterwards and this and that, but it's just a different feeling. So how you engage, really deeply engage with your hobbies, with your partners and loved ones, with your work and hobbies, just again, a little call to action. Why? Because again, the modern world is sort of pulling us out, it's making our attention more diffuse, right? It's filling up our brains with microplastics and all kinds of like strange foods. And so there's a lot we need to do to kind of pull it back and get ourselves re-engaged in what matters to us. What's the last thing we need? What's that last tenet or truth that really lets us know that we're doing it right? And that's a sense of purpose. And, that's something that we always maybe have to be attending to. I haven't found it to be what is often recommended. I find that general advice that I hear so often, especially from my younger patients struggling with this, they should follow their passion. I haven't found that to be in any way reliable or helpful in the real world to people. If folks followed their passions, I don't know. I don't think that's exactly a great way to run your show.
Well, as someone who has many passions and has found purpose in helping people, I always ask my experts, what's one time in their lives when they, on the outside, everything looked great and perfect, and then what was really happening on the inside when nobody could see this was that they were struggling. So they were wearing a mask. And how did they get through it? So I'm going to ask you that question.
Okay. That was fun. I love what you said, that you have many passions, and and I can't remember exactly how you said it.
And you said you found your purpose in helping people.
Yeah, and I just I like think, thank you. That's a nice. I mean, that's very true, and that's in some ways how I frame it in the book. But it was nice hearing it from you, because I think that it's great to have a lot of passions, and sometimes I feel like I sound like I'm dismissing passion, but that your purposefulness, your service, your higher calling. It's such a like heady, personal, serious, unique thing. For me, Judith, there have been a lot of different times in my life where people haven't known exactly what's going on with me. I came from very, very rural Indiana. I grew up in the poorest county in Indiana. So there are times when I think about wearing a mask, which is walking through the halls of New York Presbyterian Hospital as an intern, 26 years old, fresh out of Indiana University. I was the first ever graduate from Indiana University Medical School to go to Columbia Psychiatry.
Wow.
I didn't know what I was getting into in a lot of ways. That was a very exciting time, a very challenging time, I think, of needing to grow up very quickly. And at the same time, I was having a lot of fun. And when I think about sometimes probably more recently, that's maybe been more jarring. I moved from my farm in Indiana, where I'd moved with my family, maybe thinking that was going to be our forever home, and settled down. And boy, it really was a wonderful place to spend the pandemic. And then a lot of things shifted in our lives. And so for the last 4 years, I've been transitioning to a new community up, we're about a mile up in the mountains in Jackson, Wyoming. And that's certainly been a time where I wouldn't say that I've been wearing a mask necessarily, but when there's been a lot more transition. And in a lot of ways, this book came out of that experience. There's a lot about my farm, and my patients kind of come with me from New York to Indiana and now to Wyoming. And so I share some of what's going on during that transition in the book. I would say that, I try to lean towards authenticity, and where I'm wearing a mask is probably to, and I wonder if this is a bit like you, and I probably do this a lot as a man in particular, of not let too much of the negativity and the sadness or depression or the parts of myself that I maybe struggle with more, probably keep those a little bit more private. And there have been a few times. There was a time I was about to interview Carl Radke, and I was preparing. He's on one of these great reality shows, and he's one of these guys who's like gotten sober publicly. And I was preparing. For the interview a little bit, and I read that his brother had died by an overdose, and I like burst into tears, and I was sitting right here, and then I recorded this video kind of showing like, I want to show everyone like, hey, this is what's also going on too. It's like you're in the midst of making content, and all of a sudden it's like you just get in touch with like how bad this mental health epidemic is, or you are pulled into the content of the day. It's really important for me, for my patients and for my family to stay even keeled and positive, and wherever I struggle with negativity, and to not have that come through too much. And so I think that those are times that are certainly tough, when something clinical is really very challenging. I get to work with a wonderful diverse mix of patients, but it's definitely can get very, very complex in my practice. And so those are times also, I think, where as psychiatrists, once they were taught to wear a mask, but there's a neutrality that gets taught, where I think sometimes when we take it too far, people kind of lose affect. It's like, like, tell me more about this incredibly strange and traumatizing thing, right? But I would say that, boy, you've got me in here in the deep part of psychiatry. I would say that I hope I'm not avoiding your question. I think I'm probably trying.
Well, how do you get through those difficult times?
I get through those difficult times in a variety of ways. I think first, I've had a very wonderful partner and wife throughout all of the success that I've had, who always supports me, makes sure that I look a little better, and that I am taking it seriously, and that I'm doing my best. And so I think that's one of those, for me, that tenet of connection. It's really incredibly important. I would say also during this time, when I think about like the time I'm telling you about in Wyoming, that sense of reaching out to my community, reaching out to friends and family, reaching out to colleagues. I've done a lot of that probably too much at times, Judith. I feel like a lot of our friends and colleagues have gotten like a long email about, I don't know, this or that aspect of my suffering. It's so, but I think it's important for us not to be alone with this. You know, I really liked the title of your new book, High Functioning Depression. I was like, oh, I can have that, you know, because I am high functioning, and that's like that sounds a little better. And so I get through with animals. That's a really, you know, animals are throughout the book, but if you follow me on the Instagram, boy, I've got, you know, whether it's my Bernedoodle or I had a horse for a while. I just really, I don't know. I love animals, and I find a lot of just joy and solace in them. And again, there's interesting and good data about that. I would say that one of the other ways that I really find I can lose if I'm not careful during these harder times, and it's where I think it's been helpful for me to, I don't know, feel some responsibility to walk the talk as much as I always can, is when I'm struggling with my mood, just keeping nutrition in the right spot. I stopped drinking about 3.5, 4 years ago. And so that really, to me, can lead to a lot of sugar cravings. You know, I get teased by our friends where, like, if their kids leave out the Halloween candy and everybody's a few drinks in at a party, they'll like find me like, you know, eating the Tootsie Rolls. And, you know, but I actually am a lot better with that over this past maybe year but keeping, again, doubling down on nutrition, doubling down on some of what you're talking about, right? Of making sure it looks nice, not just for Instagram, but for me. Now, making sure that it's really some of the flavors and tastes that I really want to really take great care of myself. And so then I've been spending a lot of time and getting a lot of mileage myself in terms of what is helping kind of lift me up out of a sense of purpose. And really trying to be much more clear about that with myself, both on a micro level, kind of daily, like, what am I here for? What am I doing? Who am I serving? And keeping eyes on the prize of trying to really, you know, be a dad first, take great care of my kids and my patients. But that purposefulness and writing about that, thinking about that, I think probably with this book coming out, having really been fortunate to get to do a few books.
Well, we're fortunate that you have passion and purpose. And I think your book is going to help so many people. Where can we find you? Where can we follow you? And where can we buy your book?
Well, thank you so much. I'm Drew Ramsey, MD at drewramseymd.com. That's where the mental fitness quiz is, but you can learn more about our work. And you can also learn more about our great clinicians, Samantha L. Creef, Xiao Jie Hu, and Margaret Brigham, and Ben Smoke. There's also some free downloads on the website, interesting antidepressant foods, the ultimate mental fitness morning. And then I'm on Instagram, Drew Ramsey, MD. There's also an e-course, Healing the Modern Brain. Anybody who wants to get a little bit more involved and, you know, hear more of my deeper thoughts, longer thoughts. It's kind of the long jam version of the book. Please check that out. And mostly, you know, whether you buy the book or not, I hope that this talk, and I hope you're following Dr. Judith Joseph, who's just like my favorite psychiatrist on Instagram and on the internet. Really, you are so much fun. I just love that you're here, and I'm grateful that you're taking your mental health seriously. And if any way Healing the Modern Brain can help you up-level that, learn more, again, have more of this proactive, preventive framework. Tenets are things we all know are true. None of us are going to debate that connection, purposefulness, engagement, sleep, all these things, they make us feel better. I share the data of how it heals your brain, and, you know, then it's up to you. And so I hope this helps everybody listening take that next step. Dr. Judith Joseph, thank you so much. What a treat to be on your podcast.
Thank you for being on The Vault. I can't wait for people to read your book.
Thanks so much.
Thank you for listening to this podcast. Make sure that you subscribe. When you subscribe, it helps me to continue to deliver this mental health information for free to millions of listeners. So please support my mission. Please pick up my book, High Functioning, and let's build a happier life together.